Have you ever listened to your child breathe and noticed a high-pitched, whistling sound, especially when they exhale? It can be quite unsettling. You should worry about a child's allergic wheezing when it is accompanied by obvious difficulty breathing, such as rapid or shallow breaths, chest retractions, or bluish skin, or if the wheezing is sudden, severe, or does not improve with usual remedies. Any change in your child's alertness or level of consciousness also warrants immediate attention. Allergic wheezing happens when allergens, such as pollen, pet dander, or dust mites, trigger inflammation and narrowing in your child's airways. This causes air to struggle to pass through, creating that distinctive whistling sound. The severity of this airway narrowing is the key factor in determining how worried you should be. Minor wheezing might simply indicate mild irritation, but significant narrowing can restrict oxygen flow. Factors that increase concern include a history of severe allergies or asthma, exposure to known triggers, and if the wheezing is persistent and worsens over time. If your child is wheezing, first observe their breathing pattern closely and check for other symptoms. If they have an existing allergy action plan from their doctor, follow it immediately. Administer prescribed medications, such as a rescue inhaler, if available. Keep your child calm and monitor them for any worsening signs. If you notice severe breathing difficulty or bluish discoloration, call emergency services right away. For less severe but persistent wheezing, contact your pediatrician for guidance. Understanding the difference between wheezing and stridor is also very important. Wheezing typically occurs on exhalation and suggests lower airway narrowing, while stridor is a harsher, high-pitched sound on inhalation, indicating upper airway obstruction, which is often more urgent. An individualized allergy action plan, developed with your doctor, is your best tool for managing these situations effectively and knowing exactly what steps to take. By staying vigilant, understanding the signs, and having a clear plan, you can confidently distinguish between a minor allergic reaction and a situation requiring urgent medical care, ensuring your child receives timely and appropriate support.